Welcome to the Traveler's Cyber Academy, a webinar series on cybersecurity and cyber risk management. Our topic for today is Protected Health Information, or PHI. Everywhere you don't realize. In this presentation, we will demystify Protected Health Information, also known as PHI. What is PHI, and how is it different from personally identifiable information, known as PII? We will explain why PHI is so valuable and why it needs to be handled differently than other sensitive information. Mishandled PHI can have serious consequences. In particular, PHI is regulated under a statute known as HIPAA. We are all familiar with signing HIPAA releases at the doctor's office. But what does HIPAA really require? And what is needed for HIPAA compliance? We will explore some of the main components of HIPAA and explain why compliance needs to be taken seriously. Lastly, we will cover some basic cybersecurity principles to help protect PHI within your organization and beyond. Protected Health Information, or PHI, under HIPAA is any information about health status, provision of healthcare, or payment for healthcare, created or collected by a covered entity, or a business associate of a covered entity that can be linked to a specific individual. Some obvious examples of PHI include test results, treatment plans, medical charts, insurance information, photographs, and many other kinds of health and medical records. In addition to the different kinds of medical records that we just mentioned, there is personally identifiable information such as name, date of birth, social security account number, and even driver's license number. Together, all these make up PHI, Protected Health Information. On the black market, protected health information is worth 10 times more than stolen financial information, like a credit card number. For the individual whose PHI has been stolen, it can be much harder to repair the damage than it would be to close a bank account or credit card account. Stolen PHI can be used by criminals to obtain narcotics and other prescription drugs, to commit medical fraud, where a victim's identity and insurance benefits are stolen in order to obtain medical treatment, or to commit medical insurance fraud, in which a treatment provider submits fraudulent claims for treatment that was never provided. PHI can also be misused to damage or to threaten damage to the reputation of an individual, either to commit extortion or cause harm. For example, by making public an individual's embarrassing diagnosis or substance abuse history. The following fictionalized narrative demonstrates the dangers of mishandled PHI.
My name is Rachel, and here is my story. I recently tried to donate blood for the first time at a local blood bank. I was shocked when I was told I could not donate. I investigated and discovered someone had illegally used my protected health information, specifically my health insurance credentials, to receive treatment at a leukemia cancer center in California. Now, this treatment is part of my medical history, rendering me ineligible for blood donation. To date, I have not been able to permanently remove this false information from my medical history. In the end, I was provided a correction letter that I carry in my wallet in case I need it. But to be honest, I worry about this every time I seek medical treatment.
The definition of PHI refers to covered entities. So what are covered entities? Covered entities are those that collect and store PHI directly due to the nature of their operations. They fall into three main classifications. Healthcare providers include everything from multi-facility hospital healthcare systems to the lone general practitioner operating out of a neighborhood office. Any entity providing direct patient care is a covered entity, including doctors, dentists, optometrists and audiologists, mental health professionals, chiropractors, pharmacies, and medical laboratories. Covered entities also include health plans, such as HMOs, company health plans, and government programs, such as Medicare and Medicaid. Finally, a healthcare clearinghouse is a covered entity. These are entities that process non-standard health information into standard form. An example would be a company acting as an intermediary between patient care and patient billing, checking for errors and ensuring that standard codes have been used. Most healthcare providers and other covered entities need to share PHI with other companies in order to do business. Under HIPAA, these companies are called business associates. For example, a medical office may need to share patient PHI with a billing service, a transcriptionist answering service, or even a record storage facility. The contracts between covered entities and business associates, otherwise known as business associate agreements, are required to include provisions regarding HIPAA compliance, so that business associates share in the responsibility to protect and secure PHI. The following fictionalized narrative demonstrates the dangers of mishandled PHI.
My name is John, and I'm the owner of WellBe Pharmacy. Law enforcement recently notified me that my pharmacy had been involved in a fraudulent prescription ring. Following a criminal investigation, it was discovered that one of my trusted employees, Linda, had illegally accessed and distributed the pharmacy's patient-protected health information. Linda had been the pharmacy assistant for 10 years and had full access to the network system, which included all patient information. She used this access to obtain and sell the names, addresses, birth dates, and prescription details of more than 600 individuals. She sold this information to an organized crime ring who used it to illegally purchase prescription drugs. Beyond the criminal ramifications of her actions, the event also was considered a breach of protected health information. Therefore, the breach needed to be reported to the Department of Health and Human Services and handled in accordance with HIPAA regulations. The pharmacy has notified all 600 individuals affected by the breach. This process has proven to be very expensive. The pharmacy was found not guilty of any criminal act, although the same cannot be said for Linda. Now, the Office for Civil Rights is in the beginning stages of a HIPAA compliance investigation.
Just knowing that PHI needs to be protected is not enough. It is also important to think about where PHI is stored and how it spreads throughout an organization. PHI also spreads outside an organization. For example, from a hospital providing direct patient care to all of the business associates that it uses. Both the hospital and its business associates must adhere to HIPAA regulations. In the end, PHI is everywhere, in businesses spread throughout every city and every town. All of this PHI is primarily regulated by two federal statutes, HIPAA and a companion statute known as HITECH. HIPAA was enacted in 1996. It established, for the first time, a set of national standards for defining and protecting personal health information. HITECH, the Health Information Technology for Economic and Clinical Health Act, was enacted in 2009. HITECH broadened HIPAA to cover business associates, and it added requirements to protect PHI stored in electronic form. HITECH also mandated more rigorous enforcement, including a regime of regulatory fines and penalties. The Office for Civil Rights within the U.S. Department of Health and Human Services is the strong arm of HIPAA, tasked with enforcing its regulations. HIPAA started with 5 rules covering privacy, security, enforcement, unique identifiers, and transactions and code sets. HITECH added a rule regarding breach notification. Let's take a closer look at the privacy, security, and notification rules, along with the enforcement of those rules. The privacy rule lays out the who, what, and when of PHI. It identifies covered entities and business associates, the entities who are regulated under HIPAA. It defines what is considered protected health information. Finally, it specifies when it is acceptable to share PHI. It is only acceptable to share PHI in specified circumstances, such as when required by law, when reporting abuse and neglect, or when the individual to whom the PHI relates has provided written authorization. Remember, PHI can be digital, paper, or oral. The security rule defines standards, procedures, and methods for protecting electronic PHI that cover how PHI is stored, accessed, transmitted, and audited. The security rule includes 3 kinds of controls. First, administrative safeguards. These focus on internal organization, staffing, and policies and procedures that protect PHI. Examples of administrative safeguards include implementing role-based network access controls and providing appropriate training for employees and staff. Second, physical safeguards. These relate to protecting the buildings, equipment, and data from environmental hazards and unauthorized intrusion. Examples of physical safeguards include keycard access to computer rooms and privacy screens on computers. Third, technical safeguards. These focus on the use of technology to protect information and prevent unauthorized access. Examples of physical safeguards include the use of multi-factor authentication and encryption tools. Under the breach notification rule, covered entities must notify all affected individuals in writing within 60 days after their health information has been breached. If a breach occurs at a business associate, the business associate must notify the covered entity it serves so that the covered entity can notify the affected patients. In addition, a toll-free number must be provided for at least 90 days so that the affected individuals can obtain more information about the incident. Notification must be provided to the Department of Health and Human Services. If the breach affected 500 or more individuals, notification must be made without unreasonable delay and no later than 60 days. Otherwise, notification must be made within 60 days after the end of the calendar year. The covered entity must also provide notice to prominent media outlets serving the state or jurisdiction, for example, a press release announcing the breach. The Department of Health and Human Services has a searchable online database of reported breaches affecting more than 500 individuals. These breaches can be searched and viewed publicly. The database includes brief summaries of the breach cases that OCR has investigated and closed, as well as the names of private practice providers who have reported breaches of unsecured protected health information. It is not just federal HIPAA and high-tech regulations that healthcare providers must follow. As of February 2017, 47 states also have their own laws and regulations regarding data breach notification requirements that apply to PII in general. 12 states have specific requirements pertaining to breaches of health-related information. The following fictionalized narrative demonstrates the dangers of mishandled PHI.
I'm a professor at the local university. Our university's main objective is education. However, we do have a research lab, a medical clinic, and a speech lab as part of our campus operations. Having these components makes us a hybrid entity in the eyes of HIPAA, which means we are required to designate and adhere to HIPAA regulations within those areas. We take HIPAA compliance very seriously and have procedures and policies in place to ensure compliance within the research lab and medical clinic on campus. Unfortunately, the university failed to recognize that the speech lab was handling healthcare information. It was not designated as a healthcare component, and the computers lacked the necessary security controls required under HIPAA. So, when one of the speech lab computers was the target of a malware attack and protected health information was accessed, it was a breach of privacy. The attack resulted in stolen PHI for 1,300 students. The university was responsible for notifying each of the affected students and reporting the breach to the Department of Health and Human Services. The breach was made public record on the HHS breach database. It was also necessary for the university to hire a firm to conduct a forensic investigation to determine the extent of the damage by the attack. The university took a reputational hit when the breach was made public, along with spending an exorbitant amount of money on the notification and forensic responsibilities. Just when we thought we had put this matter behind us, the Office for Civil Rights came in and conducted their own formal investigation and determined the university was guilty of failing to designate the speech lab as a healthcare component of the university and in violation of HIPAA. A hefty fine and corrective action plan were the end result.
As part of its continued efforts to enforce HIPAA compliance, the Department of Health and Human Services Office for Civil Rights has begun its next phase of audits. Covered entities and business associates can be selected at random to be audited. The Phase 2 HIPAA audit program will review the policies and procedures adopted by covered entities and their business associates under the privacy, security, and breach notification rules. If a covered entity or business associate fails an audit, the OCR may implement a corrective action plan to improve controls, along with assess fines and penalties if found in violation of HIPAA. When a breach has occurred, there are 4 categories of violations that reflect increasing levels of culpability. Fines are calculated per violations. Each individual's health record lost in the breach is counted as a violation. The lowest level of civil money penalties applies when a covered entity did not know and, by exercising reasonable diligence, would not have known that it violated a provision of HIPAA. The penalties are no less than $100 and no more than $50,000 for each violation. The next level of civil money penalties applies where it is established that the violation was due to reasonable cause and not due to willful neglect. The penalties are no less than $1,000 and no more than $50,000 for each violation. The third level of civil money penalties applies where it is established that the violation was due to covered entities' willful neglect, but it was timely corrected. The penalties are no less than $10,000 and no more than $50,000 for each violation. The highest level of civil money penalties applies when it is established that the violation was due to a covered entity's willful neglect and it was not timely corrected. The penalties are no less than $50,000 for each violation. HIPAA fines and penalties have been steadily growing over the past few years. 2014 saw approximately $8 million in assessed fines. 2015 saw approximately $15 million in total fines. And 2016 saw approximately $24 million in fines. Who knows what 2017 will bring? So how can a business protect itself? Here are a few things that can be done. Encrypting PHI within data at rest, in transit, or on mobile devices helps to ensure that PHI is protected. In the event of a cyber incident, an incident response or breach action plan is critical in detecting, analyzing, and responding to a breach. Ensuring your vendors are maintaining adequate security controls and having compliant agreements in place help to ensure that you are properly vetting your service providers. Educating employees on appropriate privacy and security issues is essential. Having strong network security controls helps to mitigate the risk of a breach. Thank you very much for your time today. We hope you enjoyed this session of the Travelers Cyber Academy. If you have any further questions, please contact us at trvcyber@ems.travelers.com. For a replay of this session, to share with your colleagues, and find additional resources on this topic, please visit travelers.com/cyberadvantage.